Bismillah ar-Rahman ar-Rahim. I am Dr. Abdul Rafi from Sirajia Clinic and Trust. Today I am going to tell you something about diabetes and about its diagnosis. Diabetes, according to WHO, is a chronic metabolic disease which is characterized by high blood sugar levels associated with slow damage to certain organs like heart, blood vessel, eyes, and kidneys. The number of patients of diabetes are increasing for the last 3 decades, and at the moment, the number of patients in the world is 830 million. They are too much, and the distribution is almost equal in low income countries and high income countries. Type 1 diabetes is also called juvenile diabetes, is characterized by no insulin production by pancreas or little insulin production by pancreas. But on the other hand, in type 2 diabetes, there is usually insulin is more than normal. Insulin level are more than normal, but there is resistance. And it means cell is not using insulin. There is a lot of insulin, but it's not able to use insulin due to resistance. So today I am just going to tell you what is criteria for diagnosis of diabetes. Criteria in children and adult is same. Criteria in children and adult is same. There are three things which we need to measure. There is fasting blood sugar, random blood sugar, and hemoglobin A1C. But criteria for gestational diabetes is different. So first I will talk about fasting blood sugar. If your fasting blood sugar is 900 to 125, if your fasting blood sugar is 100 to 125, you are pre-diabetic. But if it is lower than 100, and it is 99, it means you are not diabetic, and 100 to 125 you are pre-diabetic, and if your sugar is 126 or more than 126 you are diabetic. This is criteria for fasting blood sugar for diagnosis of diabetes. On the other hand, random blood sugar, if it is more than 140 to 199 you are pre-diabetic, and if you are having more than 200 or 200 with symptoms of polyuria, polydipsia, and polyphagia, unfortunately you are diabetic. You need to talk to your doctors. The third criteria is hemoglobin A1C, and its level, if it is 6.5% or more than 6.5%, unfortunately you are diabetic. You need to talk to your doctor. He will advise you some diet management, some plans, some exercise, and he will choose a medicine for you. Thank you very much. Have a good time. Okay, Allah Hafiz.